I'm here for a routine checkup.
Okay, Ms. Johnson, what I'm going to do is start off by taking your temp today.
Routine checks are an important part of staying healthy. As part of your visit here today, we provide all our patients an HIV test. It's a routine but important test.
When you go to a doctor for an annual visit, and the doctor says, okay, I'm gonna check your cholesterol, and I'm gonna check this, that, and the other. A person doesn't say, well, wait, I'm a vegan, I'm a vegetarian, I don't eat meat, I don't eat dairy, I don't eat cheese, I'm not at risk for high cholesterol. A person takes it because they're used to it, it's normalized. And that's what we want to do with HIV testing. We want to normalize it. If we're sexually active at all, we're at risk for HIV. So therefore, we want people to be aware, show you care, know your status.
Many people in Chicago have HIV, and many of those people don't know that they have it. Why? Because they haven't been diagnosed yet.
HIV only affects gay men and drug users, so I don't need an HIV test.
Anyone who's had any type of unprotected sex is at risk. People who share needles are also at risk. And infected mothers can pass the virus on to their babies during pregnancy, childbirth, and breastfeeding.
I don't have any symptoms and I feel great, so I definitely don't need to get tested.
You can be symptom-free for years after being infected with HIV. But remember, early detection of HIV will avoid complications later on.
I don't want to know, because if I test positive, there's nothing I can do about it, and I'm going to die from it.
With modern medicines and good health care, you can have a long and healthy life.
Knowing my status is the single biggest thing I can do to protect my health.
An HIV test is confidential, easy, and accurate. Results are provided quickly, and you may opt out at any time if you do not want the test. If you have any questions about the test, feel free to ask anyone on the clinical team.
It's really important to test for HIV because 1 out of 5 people with HIV don't know their status.
The CDC recommends HIV testing for anyone from 13 to 64 years of age. The reality is that anyone who's sexually active should be HIV tested.
All right, Erica, let's get this back. Okay, all done. You happy?
Ms. Denton, I have your test results. The HIV test came back and it was all good news. The test was negative.
A negative result means you do not have HIV. However, if you've had sex without a condom or shared needles in the last 3 to 6 months, you must have another HIV test in 3 months to be certain you are not infected.
I'm glad I took the test, and now I know my status. I do not have HIV.
A preliminary positive result means it's likely you have been infected. In order to be absolutely sure, you'll need an additional test.
Because there's so many benefits to knowing your status. With new medications and regular checkups, you can stay healthy for years and years to come.
HIV is a disease that you can live with, and that most people today, if they're treated and they stay in care, they can be treated and live a full life, meaning that they can work, they can have children, they can see themselves growing into old age. And I think it's important not to be afraid to get tested because of the results.
From being diagnosed a couple months ago, I was kind of nervous. I didn't know what to expect. Now just walking the walk and talking the talk, I feel so much better, and I know that it's not a death sentence, and it's not a hopeless situation. It's really hopeful. I know my status. I know what I have to do to remain healthy. I know I have to, consistently, take care of myself and ask questions, because that's the only way that I'm going to know how to do better.
Here in Chicago, we have some of the highest rates of HIV, and it really doesn't matter what you think your risk is. What matters is that you get tested.
Routine HIV screening will allow everyone to continue to live a healthy life. Whether HIV positive or negative, our HIV screeners are here for you and will answer any questions you might have. We have a caring team and many resources. For more information, visit cdc.gov/HIV.